I'm Erica, and my partners are Jessica and Summer. We chose to do the ethical dilemmas faced by nurses in a changing environment. All healthcare professionals face ethical dilemmas within their profession. Nurses have a lot of responsibilities within their job that can be overwhelming, which leads them to facing a lot of ethical dilemmas. They have responsibilities such as monitoring patients' illnesses, their responses to medications, and their display of comfort and pain or discomfort and pain. Also, when nurses have too many patients, it can be difficult for them to attend to them all, and spending a lot of time with one patient affects the quality of care that other patients receive. Nurses' overwhelming amount of tasks can lead them to make poor ethical decisions, and they do not properly display their ethical principles. The title of the case study that we chose is a descriptive case study on the changing nature of nurses' work, the impact of managing infectious diseases requiring isolation. This case study was by Alicia Kaba, and it was published in the American Journal of Infection Control.
Hi, I'm Jessica. Our case study that Erica introduced focused on how nurses are taking care of patients with infectious diseases and how caring for these patients is becoming more time consuming. A lot of hospitals are facing an increase in infectious diseases that are antibiotic resistant. This has caused hospitals to implement new infectious prevention and control policies to try to stop the spread of these diseases. The case study was performed in Ontario, Canada from March to April 2011. It was performed on a site with 7 hospitals, and 5 of the hospital units were used. They interviewed 4 nurse managers, 2 nurse executives, and 12 frontline nurses. The nurses were interviewed and asked questions in regard to how the new procedures that had been implemented were affecting their, the care they were providing. So some of the questions that were asked in the study were, how has your work changed within the last 5 years because of the rise in infections requiring isolation? This question was used to address how nurses felt they were dealing with patients with infectious diseases and whether the time they were spending with these patients and with other patients was increased or decreased. The second question was, what is your perception of the type of care that is received by patients in isolation? And this question was used to determine if nurses felt that the patients that were in isolation were receiving good care or bad care, or worse than if they weren't in isolation. And then the third question was, how have policies on isolation precautions and personal protective equipment affected your work? And this question refers to whether the new policies have affected the nurses' work positively or negatively, like within time frame and just extra work added to their days. So the results of the study found that nurses' work was found to be affected greatly by the new isolated infected patients. The study found that nurses were spending extra time to deal with these patients and that they were adding 20 minutes to 2 hours to their shifts. This is a lot of time when they have to deal with multiple patients, and a lot of this time was spent putting on personal protective equipment such as gowns, gloves, and masks. Nurses also stated that being that there was this increase in time added to their shifts, they began to have to cut corners. So they felt that they weren't taking care of the patients as well. Nurses also said that with the new procedures, there was an increase in non-nursing tasks, such as having to move patients that had become infectious to isolated rooms. In the end, the nurses felt that the care received was worse than before they implemented these new procedures, and they felt that the time that they were spending with patients was not met, and they felt that they needed to look into ways to figure out how to be able to spend more time and better take care of the patients.
I'm Summer, and ethical issues presented in this case study were beneficence, lack of compassion, lack of kindness, improper care, and poor quality care. This was due to an arise from the nurse's actions and lacking time. An example of this in the case study was when nurses left isolated patients' room with their protective equipment already on because they needed to get additional equipment and had no one to help. In this situation, nurses are contributing to the spread of the diseases, which is obviously an ethical issue. To solve this problem, it would probably be ethical to hire more nurses. This would make it so you would reduce overwhelmingness, less patients, more proper care, improved quality of care, and better values displayed by the nurses. This way, nurses would have more time to focus on sanitary protocols. In conclusion, hiring more nurses may reduce time constraints and improve the care for the patients. Nurses are dealing with increased time spent on patients, which will definitely cause problems. There's increased ethical issues, and yeah.
The interactive part of our case study is questions regarding the case study. The first question is, what was the case study about? The answer is C, nurses spreading infectious diseases due to lack of time. The next question is, which is not an ethical dilemma the nurses in the case faced? The answer is D, non-maleficence was not an ethical dilemma faced by the nurses in the case. What are some common duties of nurses? The answer is D, all of the above. All of these are duties that nurses face on a daily basis. What is our potential solution to this issue? The answer is B, hire more nurses. Our answer to the case study was to hire more nurses to alleviate some of the time that was spent taking care of the infectious patients. Where did the case study take place? The answer is A, the case study took place in Ontario, Canada. Who was interviewed in the study? The answer is C. Nurses were interviewed in this case study. How much extra time did the infectious patients add on to nurses' shifts? The answer is C. 20 minutes to 2 hours was added on to nurses' shifts due to dealing with infectious patients. What are some protocols nurses were forced to do in this study? The answer is D, all of the above. All of those articles of equipment were used to protect nurses from infectious patients. Hi, I'm Jessica,
I'm Erica.
And I'm Summer.
and this concludes our presentation on our case study. Just to reiterate, our case study focused on the increase in nurses' work from the increase in infectious diseases. The increase in amount of infectious diseases is adding 20 minutes to 2 hours to nurses' shifts. This increased amount of time is causing nurses to cut corners and perform trade-offs in order to accomplish all of the cares they need to within their shift. We are recommending that hospitals look into hiring more nurses to try and fix this deficit of care. And thanks for watching.